Art is a part of everyday life for Heidi Everett, and so is taking quetiapine. On New Year's Eve, she needed to refill her prescription.
I went around 5 chemists in my local area. They were all out.
The drug, also sold as Seroquel, is relied on by people who live with schizophrenia and bipolar. Last year, it took only 2 weeks without the medication for Heidi to end up in hospital.
I was crying in the chemist because I'm terrified of what happens if I don't take my meds.
We've had people calling dozens of pharmacies trying to source, the medication that they desperately need.
The Therapeutic Goods Administration says 2 brands of quetiapine 25 milligrams are unavailable in Australia, and there's limited availability of another 25 milligram brand and one 300 milligram version.
People could have acute psychotic episodes if they weren't able to access this medication.
The TGA says as a workaround, higher strengths can be halved or quartered to obtain a 25 milligram dose.
I'll show you what it's like having to cut one of these.
But splitting tablets is not easy.
It's no guarantee that the tablets are exactly the same size.
Medicine shortages have been an ongoing global issue since the pandemic. To protect patients, in July 2023, the Department of Health introduced minimum stockholding requirements of some critical medications.
There are 7 brands of quetiapine 25 milligrams on the list, meaning the pharmaceutical companies are required to hold a supply of 4 months of the drug. Now, the Department of Health has told the ABC they can't let us know whether those obligations have been breached because that information is subject to secrecy provisions.
This is perhaps one of a number of medications that we're not keeping enough of on shore.
The TGA says it expects all 25 milligram tablets to be available again by late February, but some 300 milligram tablets will remain in short supply until June. Mary Lloyd, ABC News.